Good morning, everybody. Welcome to another episode of QRA Live with me, your host, Jimmy Yin, aka the AcuSensei, coming to you live every Sunday, 8 a.m. Central Standard Time. And like always, put into the chat. If you have logged in early, get into the chat quicker so that you can put in the health condition that you're struggling with, that you need help with, and I will immediately demonstrate a QRA, um, quick restorative acupressure, to help you move blood to that diseased area or that troubled area in your body, which will help your body to start healing. So put into the chat what you need help with. And so while I'm waiting for everybody to type in their ailment, their chronic health issue, I'm going to give a disclaimer. So again, if you're logging in, type into the chat, live chat. I've got it pulled up. Type in what you want help with, what you want a QRA, um, a quick restorative acupressure tip to help you improve your blood circulation to your specific organ or specific part of your body. And so uh, I'll wait for everybody to type that in. Disclaimer, I am not a physician. I am not a medical doctor. I was not trained to prescribe medication and to do surgery. So I'm not going to uh, tell you what to do with your medication and surgery. I am a licensed acupuncturist, Chinese herbalist, trained in traditional Chinese medicine. I am an expert in restorative longevity. It's something that I coined. It's different from longevity. Restorative longevity is having your body be able to do it by itself. Most of the longevity, I would say, treatments, recommendations these days are to take something, take a supplement for longevity, take a medication. I was reading a book by a physician, and he wants to, everybody's so interested in longevity. How can we live longer? And physicians, they're training medication. So guess what? They want to research a medicine that people can take that can make them live longer. That's not this channel. Okay. So this channel is about how to get your body to heal itself by itself, the way God built it to do. So type into the chat what you have, what QRA you want me to do. Again, I have to say this because otherwise YouTube, Google is going to close down my channel. You always need to talk to your physician before you do anything. Okay. I'm not dispensing medical advice. I'm just sharing with you cases that actual cases. Our clinic, we still treat patients. Okay. I'm not a YouTuber that doesn't have a practice that is thriving. I'm not a YouTuber that just does research and then just regurgitates research to you. The information that I share is actual information that we use on our current patients right now. We've treated thousands of patients. And the information that we also advise our patients to do, whether it's nutritional information, lifestyle information. So type into the chat. This is QRA Live. QRA Live, quick restorative acupressure. It is different from acupressure. How is it different? Some people have asked. Acupressure, you are given points, right? You do this point. Oh, you do this point, and it will help with this, right? QRA, there are no points. There are no set points. That's one of the biggest difference with quick restorative acupressure and regular acupressure. Acupressure, you're just given points. And what if it doesn't work? Oh, then try it, point number two, number three, number four. Okay, what if that doesn't work, right? I'm not saying it doesn't work. I'm just saying how the difference, right? I don't use points in my quick restorative acupressure. So, what ailment do you want help with? Type into the chat. First come, first serve. Just make sure my chat is opened. What ailment do you need help with? And I will show you a QRA right now. Okay. Um, so while people are thinking about or maybe typing in, I'm going to start talking about, I was talking about intermittent fasting. I just did a video on intermittent fasting yesterday. And so intermittent fasting is something that everybody needs. If you didn't know that, you need to do intermittent fasting. It is, I would say, requirement for you to stay healthy. And for, some people may say, oh, no, no, Jimmy, intermittent fasting, my doctor told me it is not healthy for me, or my doctor said it is dangerous for me. Well, let me give you a clue. You are already doing intermittent fasting. You may just, you, it just may not, you just don't call it intermittent fasting. When you are sleeping at night, you are fasting. And intermittent fasting means you're not doing fasting all the time and you're doing intermittent. So every time you sleep, you fast. But when you wake up, you don't fast. That is intermittent fasting. Good morning, Anna. Good morning. Thank you for joining. So again, type into the chat. I'm just going over intermittent fasting, waiting for people to type in what chronic health issue you need help with and you would like to see me show you a QRA, quick restorative acupressure. Okay, so as y'all are typing that in, I'm going to continue my topic about intermittent fasting. So intermittent fasting, you absolutely need it and you're already doing it. You're already doing it. Every time you sleep, you're intermittent fasting. The only difference is you're only doing it for 7 hours, 8 hours. Some of you only 6 hours, 5 hours. Okay. So why do you need to do intermittent fasting? Intermittent fasting is the only time your body stimulates something called autophagy. What does that mean? Self-cleaning. That is the only time your body does self-cleaning. And what happens during autophagy? Autophagy is not just cleaning, the streets. It's about, hey, cleaning. It's about going into looking at every cell in your body. So you got these, AI bots in your body, okay? And they're identifying which cells are not performing. Which cells are not performing? Those are the ones they go and break down. They break down and they break up the cell and they see which parts of the cells are still usable and they get those. The rest of the stuff they eliminate. Okay. And so good morning, Leanne. Okay, so Anna's got one for quit smoking, reduce cravings. Perfect. Okay, so let me just finish my point with the intermittent fasting. So intermittent fasting is when you're cleaning, your body cleans it, and it not only cleans it, it gets rid of the dysfunctioning cells. Because if you don't get rid of the dysfunctioning cells, those cells clump together and form a tumor, and you get cancer. Voila. Those cells clump together and they trigger an immune response, and you get an autoimmune disease, right? So that is why it is vital to you have to intermittent fast. Okay. I will be doing a podcast on how to do intermittent fasting. And be sure to tune in because I'm going to teach you something that you're not going to see on other YouTube channels. Okay. Everybody talks about, oh, if it's 16-hour, oh, you should do it 15-hour, 12-hour. Okay. They all say the same standard things, but in our clinic and what I tell our patients, completely different. Okay. So stay tuned. But let's go to the QRA. So Anna's the first one. Quit smoking. Please to reduce cravings. Okay. Quit smoking is one of the hardest things to do. I would say it would be easier to treat somebody with an autoimmune disease than quit smoking. Okay. Um, Not that it's more complicated, it's because quit smoking is 90%, if not higher, willpower. This is a fact. Okay. I'm going to show you some QRA, Anna, so don't worry. But I'm just saying, if someone who wants to quit smoking, 90% is willpower. If you don't have it, it doesn't matter how many QRA, it doesn't matter how much acupuncture herbs, nutritional, supplements you take, you won't quit. Okay. So that's how to fix it. But let me show you some techniques. Okay. So this is a acupressure. Okay. This is acupressure. This is not QRA, but acupressure, there is a point on your wrist. Okay. In Chinese, it's called tian mi. And it means sweet. It means sweet. Okay. And so what you're going to do, how you're going to find it is you're going to first go to your wrist and do your hitchhiker thumb. So hitchhiker thumb is like this, and you see your tendons come out, right? Get my little pointer here. You see inside the tendon, if you push down right there, there's a little hole, there's like a little indentation, right? So you're going to go there. Okay. And that's not the point. the point is you need to draw a line up your arm. So you're going to go along the radius bone. So you put here and you'll touch the radius bone. Okay. Just this bone. When you push your finger into this indentation, you will naturally feel a bone. This bone is the radius bone. That's all you need to know. And you need to just run your finger along that bone, okay, to about an inch to an inch and a half. That area, okay, you want to wiggle around and you want to find a tender spot. This is an acupressure point. It's not a QRA. I will show you QRA in a second. So this is acupressure. So you want to go here, right? And that is it's what we're taught in school, okay? It works for some people. I'd say 50% success rate. You want to push, so every time you have a craving of smoking, you want to push on that point for, about 30 seconds and see if that craving decreases. If it doesn't, push on, use your other wrist, okay? Use your other wrist, and if the other wrist doesn't work, that point's not going to work. That's unfortunately acupressure. Let me show you QRA. Okay, QRA, you have to understand first, smoking, right? Smoking, what does it damage? Your lungs. So I would address the lungs first, right? And the lungs, you can still use your wrist, okay? But you're going to do a different area. Let me show you this way. So I was telling you to go on the bone, this line. People call it the meridian. I call it just the nerves, okay? This line right here, right? What you're going to do is you're going to go inside. So this was the line for that sweetness point. You're going to go inside. So I'm going to flip my wrist. So the sweetness point was here, was here. So now I'm going to go inside to another. And draw a nerve. There's a nerve. You see this way. Yeah, this is better. So a nerve that goes here, and there's a line that goes here. This nerve is connected to your lungs, okay? So you can press all around here, all the way up to your elbow. Now, why is that? Because if I'm doing, this is QRA. Look at my hand, look at my head. This is my head. This is my head. This is my neck. Guess where my lungs are? My lungs are right here. My lungs are right here. So I'm going to press inside, okay? I'm going to press inside this nerve, okay? And just find that tender spot. And that's going to stimulate blood to your lungs. And when it stimulates your lungs, right, that could help some of the cravings. So you've got both hands, both arms that you can do that with, okay? So you can find the tender spot. When you have the craving, press on that, right? There's unlimited points using my QRA, okay? It actually goes all the way up. It actually goes all the way up inside actually it goes over here, sorry. It goes up here, inside, all the way, and then eventually that nerve connects to the lung. That's why I'm stimulating nerves all around, okay? So find the tender spot and press on it, right? So let me know if you have the craving right now. I would love for you to press on it right now. Let me know if it works. Okay, Anna? All right. Next one, Leanne. Good morning from northern Minnesota. Thank you for joining. Live life better. Hubby has I can't ever pronounce this, Dupuytren's contracture, which is in the hand, right? How can we help with an aching thumb when he has to write a lot for his work? Oh, okay. So we are going to you want to do the local area first, okay? So it's the tendons, the tendons are swollen. There's a ball, and it doesn't allow it to glide. That's what the Dupuytren's contracture. I know I'm not pronouncing it right, okay, but I know what it is. Okay, so I would say the local. This is just acupressure. You want to push on that just to massage downwards. Okay, that's the first thing I would do. Right, and then you want to relax the tendon. So if you're typically, I see it with the third and fourth digit when I treat patients. When I was treating patients, we see it in the third and fourth digit. I haven't seen it in the thumb, but It sounds like your husband's is in the thumb. So you want to massage it. It's going to be a little painful, yes, because it's swollen, right? You also want to take some anti-inflammatory herbs, right? Um, you're in luck. I did a podcast on I did a podcast on turmeric. Turmeric is good. Just make sure you don't overdose on turmeric, okay? So you can do turmeric, you can do ginger. Ginger root is an anti-inflammatory. Here's another thing, live life better. You can get the turmeric and the ginger and make a paste and apply it on the thumb. Okay, and leave it on for 30 minutes. It should dry up. So you make it, you just get a little water, you get the powder and you put a little water in it, and then you just make it to a little paste, and then you put it on the thumb and leave it for 30 minutes. If you have like a glove, you know, like those surgical gloves, tell your husband to put it over there so it stays on there. You can put a gauze over it first, okay, and just keep so that this area can absorb that anti-inflammatory. And you can also take it internally too, right? So here's another QR. Here's a QRA. All right, you're gonna go to your feet. Tell your husband to go to his feet. Okay. So thumb is where's my oh, let me go. Let me do this. Okay. Thumb is the big toe. So guess what? Look at this. Let's see if you can see this. See, here's a tendon right here. So you can press, have your husband press on this tendon on top, right? And find a tender spot. If he so search here because this is a big tendon. So my QRA, if you want to treat a tendon problem, you find a tendon. That's how the body works. Okay. So I'm pushing on this tendon right here, finding a tender spot. See if it works. If that doesn't work, you've got other tendons all around. Okay. You can find those other tendons and press on it, even from the bottom side. You can find the tendon and press on it. He will find a tender spot. Okay. If his thumb is inflamed, tendon is inflamed, he will find one down here. So choose which one foot and massage, right? And you know, there's those little balls. You can use a little, you know, in those spiky balls, and you can just have him rub his big toe, his foot over it. So it massages these tendons down here. Okay. So give that a try and report back. Okay. Comment back and let me know if your husband's getting better. Okay, I've got only about 12 minutes, so let me get, and then I'm getting more comments, so let me go through this, okay? A little faster, so I can help more people. Um, would that be the same point for craving or bad habit, not just smoking? Um, when I was doing the lungs, yes, if you're talking about like other smoking a little other something something, yes, it could. It could help if it's damaging the lungs. Okay. All right, Faith Dixon, thank you for joining. What is the best diet for hypothyroidism Hashimoto's? Great question. The best diet, it depends. I know you're gonna hate this answer, but it depends. Why does it depend? Because everybody's Hashimoto's is different. Like when if you go to a Western medicine doctor, they will give you the same, they'll give you thyroid, they'll give you T4, synthetic T4, right? Synthroid, or now they have synthetic T3 or so-called natural, like Armor. You know, they say it's natural because it's from a pig's thyroid. Um, that's questionable. But they give, regardless if you have Hashimoto's, regardless of which organs are dysfunctioning, regardless of your health condition, regardless of all the what damage you've done and other people have not done, they give you the same treatments, right? And when you go to a functional medicine doctor, you go to a functional medicine chiropractors, a lot of those, naturopaths, even acupuncturists, they still give you similar. They may have, so a Western physician will give you just one thing, one treatment. And you go to a natural doctor, a functional medicine, chiropractor, acupuncturist, physician, they may have, okay, 3 or 5 more treatments, right? Different types of treatments, maybe 3 or 4. That's the same with the diet. If you go to functional medicine, they'll put you on the same diet. They'll say, hey, anti-inflammatory diet, autoimmune diet, those help some people and they hurt some people, right? What I will tell you is this, Faith, you got to start at the root. If you really want to fix this and reverse this, because we in our clinic, my team has helped people reverse their Hashimoto's. Okay. How do we know? Well, it's not just based off of symptoms. Okay. Because if you're just basing off things off of symptoms, you can just take medications. Some people have Hashimoto's, they take the medications, and they feel better and they think, oh, I'm cured. Well, they're not. Same thing, right? So we base it off labs. So that's how they diagnose you. Your TPO antibodies, your TG antibodies are severely elevated. We are able to drop them back to normal, right? For some patients, not all patients. So you got to figure the root cause. What is the root cause? This is what we do in our clinic. The root cause for everybody that's similar, okay, is your intestines, your immune system. Your body's attacking itself. So that means there is a problem in your intestines. So for every person who has an autoimmune condition, one of the root is not the only root cause. One of the root cause is the intestines. You have to choose a diet that helps restore your intestinal cells, helps your intestine heal. What I can tell you is at one time there was the paleo autoimmune that damages that may temporarily help, but it damages it, right? The first thing I would do, there's no perfect diet, but the first thing I would start someone, what we do in our clinic, is a vegetarian diet. A vegetarian diet slash um, Mediterranean diet. We start from there with a little fish. Now, it depends if someone is sensitive to fish, okay? And why is that? Because all animal protein damages the intestines. That is a fact, okay? And actually, I was doing some research yesterday about animal protein diets, all these carnivore diets, paleo diet, Atkins diet. Every research that is done on these animal protein-based diets are only short term. There is no research. I went to PubMed, haven't found a research that researches people on animal protein diets for more than 10 years. Okay. So when you hear someone saying, oh, the animal protein diet is so good, it does this, they're absolutely correct. But it's only short term benefit, long term damage. So depends on what you want. I'm not saying what's right or wrong. So that's why in our clinic, for our patients, we start them on a vegetarian diet, slightly leaning towards Mediterranean. If they can tolerate fish, then we go to Mediterranean immediately, okay? Because that actually is the least damaging to the intestines. Again, why do we need to help the intestines? Because that's the root of your immune system, right? Now, other organs could be damaging the intestines, and that could be also your root cause, right? So, for example, the adrenal glands. We see this a lot with Hashimoto's. The adrenal glands are one of the organs that damage because of their dysfunction. They sit on top of your kidneys. Because of their dysfunction, it damages the intestines. So we have to fix the intestines, but we also need to fix the adrenal glands. Because if we fix the intestines, but the root cause is the adrenal glands attacking the intestines, well, you can fix this intestines. It will only be fixed for a little bit because you didn't fix the thing that's attacking it, right? So you got to fix the adrenal glands. Now, how do you detect all that? And there's different ways. I'll just tell you, what's in commonly in Western medicine and actually functional medicine, they use labs. They use tons of labs to determine, right? And some of it's actually many of it's beneficial. They may do urine test, saliva test, right? Saliva is really good for adrenal test, but it doesn't test everything in the adrenal. In our clinic, we use all of those. In addition to that, we also use something that I created. It's called functional pulse diagnosis. That gives us, combining all of those diagnostics gives us a more clear picture and a more accurate picture. That's why we get phenomenal results in our clinic. Okay, so let me move on because I only got a few more minutes. Hopefully that provides you with some insights, Faith. Let me know. Will that stain the skin? Oh, the turmeric. Yes. Um, that's a good question. I have not heard of people saying that it's a permanently stain of the skin. So give it a try. Okay. Um, but I haven't heard of people saying that of our patients saying that it permanently stains the skin. It stains the skin temporarily, but I don't know about permanently. Okay, so that's a good question though. Worked well, thank you, tried, worked. Awesome, Anna. So it worked. Great. So she was for the and thank you for the menstrual cramp tips for the daughter. She swears by instant relief. Awesome, Anna. That's what I love. And hey, if it doesn't work, let me know, guys. I'm not, I've got 100 different ways to do to do QRA for you. Okay. So, but I'm happy that the first one I introduced for Anna and her daughter, it worked for smoking sensation, and also menstrual cramps. Awesome, Anna. Thank you for sharing. I love that. What are your best points for weight loss? Oh, this is a big topic. Again, this is the uh this is the it's a very general topic because there's many causes of weight loss. Um, but I would say, but I'm still going to give you an answer. Okay. I did a reel before. I think I called it Jiggle the Baby. Okay. So you're going to find your belly button. My belly button's right here. You're going to find your belly button. You're going to go about 1 inch to the right, 1 inch to the left. Okay. And I'm going to just dive in like this. And I'm going to go up and down. I'm going to dive in and go up and down. I'm going to jiggle my baby. Jiggle my baby, jiggle my baby, jiggle my baby, jiggle my baby, left and right, jiggle, left and right, jiggle, jiggle it all the way. Okay. This actually stimulates your stomach and your intestines, which are crucial for your for weight loss. Okay. But there's a million points because there's so many different causes. Okay. Tune in next time and if you can ask some more specific, if you know what is the cause of your weight loss, I mean, your weight gain, I can get it more specific. Okay. But I just got a few more minutes, so I want to get to other people's comments as well. Leanne said, my son's legs have been constant edema, lymphedema. Sorry to hear that. And his legs and feet are swollen. In his middle 40s, it's been happening for 4 to 5. Oh, that is not good. So, Leanne, here is a couple of things. One, you need to do local compression, local compression. Okay, you can buy these things on Amazon, and they just compress the legs. Okay, they're lymphatic massage. My mother-in-law, who got hit by a car last December when she was in hospital, that's what they put on their legs. So what it does is you put it on your leg from here to in your whole foot, and it just massages. Okay, it massages it up. It massages it up, right? Because when you have lymphedema, okay, in your legs, it's because your veins have a problem. Okay. But this machine helps you just massage it up, massage it up. So that's one thing that you should do. Is it going to fix it? No, that won't fix it, but that will provide him some temporary relief. Okay. Now, most of the time, there's actually many causes of lymphedema. One of the results, not the cause of lymphedema, is in your veins, we have these valves. Okay. Actually, it goes like this, right? And so every time you move and exercise, it opens the valves and the blood goes up, right? It goes up. The problem is if you don't exercise, eventually it gets swollen, 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 and the valves become open. And so gravity pulls the blood and the fluid down and it stays in the feet. So you want to get your son to walk as much as possible every day, at least 30 minutes. If it's too painful to walk, you want him to get on a bicycle, a stationary bike. You can get on a stationary bike. If it sounds like it's pretty severe, I would say I do at least 30 to 45 minutes. Okay. You need to figure out why is it this vein problem? If it's this vein problem and it's been for that long, I don't know if there's anything that can reverse it. There are things that can improve it, but I don't know if it can reverse it. Okay. Obviously, the organ that I'm thinking of right now is your spleen. It's his spleen. His spleen may be dysfunctioning. Spleen and kidneys, because kidneys are the water metabolism organ in your body. So I would focus on those two things. Another thing, besides actually using that machine to massage his legs, remember, I don't know if you know, I don't know. You may not know. The arms, image, the legs. Okay. So also have him massage from his fingers, okay, all the way up to his arms and just massage. Do lymphatic massage this way too. What's the purpose of that? We're trying to move blood and fluid back to the heart and back to the kidney. Because the only way he's going to get rid of that extra fluid is to pee it out. That's the best way. He can poop it out and it's not so comfortable, and he can sweat it out. Okay. So also that's another thing is get in an infrared sauna. If he can get into an infrared, not a normal sauna, infrared sauna. Okay. Infrared sauna, that will encourage the blood and the lymph to circulate back to the kidney so he can pee it out. Okay. If he is taking a diuretic, when you go to Western medicine doctor, all they'll do is give you a diuretic. And this is going to be kind of funny and not funny, but this is medication. The diuretic basically means it's going to help him pee more. But if you go read the side effects of that diuretic medication, you're going to be shocked. What it's being used to what it's being used to treat is also its side effect. So it's used to help eliminate fluid from the body, but it also causes fluid retention. That's the side effect. So that's why I say if you are on medication, your body is not healthy. Okay. So yeah, it doesn't work. Those diuretics do not work because they make it worse. Okay. They maintain it at a certain point, but it doesn't make it better. All right. My body did much better on the anti-inflammatory pescatarian diet, VAMP. Yes. Pescatarian diet, yes, I would agree. That is a good diet to start from. I stopped it over 2 years ago. Once I retired and I gained weight, I need to go back to diet. Yes. Pescatarian diet, Mediterranean diet, similar. Uh, it's I did a podcast on this. It is the best diet. Uh, I would say out of all the diets, it is the best diet. Okay. All right, guys, thank you for tuning in. I appreciate you. Get in early next time so that you can type in your ailment and I can spend more time on it. When there's more people, I just need to go through faster. I hope you understand. But if I didn't answer your question or if what I suggested didn't work, come back next week. I'm here Sundays, 8 a.m. Central Standard Time, and I will give you another way. Okay. I've got 100 ways for every problem. Okay. Why? Because we've treated thousands of patients in our clinic. We've had lots of experience. Okay. All right, guys, make sure you hit the subscribe button and I'll see you next week. Peace.